Good afternoon, everyone. I'm really delighted to have an opportunity to be here with you this afternoon for what is a really topical conference, a topical and timely conference. We've got to remember we're having this conference in the context of a warning only weeks ago from the European Commission, where they advised very, very clearly that vaccination coverage is now decreasing and vaccine-preventable diseases are increasing, posing an obvious risk for public health and for public security. Indeed, when the World Health Organization listed this year the biggest challenges and risks to public health, they listed vaccination hesitancy as amongst the top 10 risks to public health globally this year. So I know everybody in this room, we're somewhat preaching to the converted in terms of the people we're talking to in this room, and indeed the people who are watching in across the country. But it is so important, now more than ever, that we all come together and that we stand up for the importance of vaccines and vaccinations, and that, quite frankly, we push back against the nonsense, the lies, the misinformation and the myths that are making diseases that we thought were confined to the history books become somewhat more commonplace again and risking the health of our children and vulnerable people in our country. There's no doubt that immunisation is one of the most successful health interventions of all time. Worldwide, they reckon that immunisation prevents approximately 2.5 million deaths each and every year. It has achieved benefits for humanity that were once simply inconceivable: the eradication of smallpox, the virtual elimination of polio, protection against cervical cancer, and protection of our most vulnerable against influenza are things that we could have only imagined many years ago. And indeed, the immense suffering that today's vaccine-preventable diseases caused to children, families and societies just 50 years ago should act as a constant reminder that we need to keep promoting and investing in our immunisation system. There is a risk that for generations of parents like myself that we take for granted the success of the vaccination programme, that we can't remember the diseases that cause so much havoc, so much damage, so much death to children in this country in the not too distant past. And we must not allow vaccination's success actually let us forget that incredible fact. In recent years, we've continued to add to our childhood immunisation programme. We've added the MenB and rotavirus vaccines to our childhood immunisation programme. The incidences of rotavirus, I'm so pleased to learn at this conference, have now fallen by 72% since we took that decision to introduce the vaccine against rotavirus. From September, I'm really pleased that we're going to be introducing the HPV vaccine for teenage boys, having a gender-neutral approach to the importance of the HPV vaccine. And we'll also be introducing the AC, W and Y vaccine against meningitis for both boys and girls. So we continue to expand the provision of the flu vaccine, and next winter people will be offered the new flu vaccine for the very first time. We cannot allow this work and its potential benefits be undermined. Misinformation, disinformation and downright lies about the benefit and the safety of vaccines, particularly on social media, are threatening its success. We're now seeing the impact of the Wakefield era in terms of the outbreak of measles and mumps, not just in this country but in others. So this is not harmless stuff. You all know this. This is not harmless stuff. When you can allow that disinformation take hold in a country, the years that follow we see more of the diseases. So it's not consequence-free nonsense that these people spread. Across Europe, governments and healthcare officials are trying to confront the challenge and end the lies being spread about vaccination. I just met my Swedish counterpart this morning in Dublin to talk about how we can work together across the European Union to try and push back in this area, because high confidence in vaccination programs is absolutely crucial for maintaining high coverage rates, especially at levels that exceed those required for herd immunity. It is becoming very, very clear that we need to redouble our efforts in this regard. Very worryingly, recent polls have found nearly half of Europeans now believe that vaccinations cause serious side effects, and more than a third of people, bizarrely, claim that they cause the diseases that the vaccine actually attempts to prevent. These beliefs are based on untruths, but they're sincerely now held by many citizens across the European Union and across this country. Vaccines work, they save lives, and it's not a matter of opinion or debate. It's an absolute fact that we must and that we will all stand up for. As a consequence of reductions in vaccination rates, we're now seeing outbreaks in many countries, including Ireland, and we know that children's health, and you know from your own work, has been adversely impacted. So far this year, there have been over 1,200 cases of mumps, and there have been at least 59 cases of measles already reported, compared to 76 for the whole of last year. We've also had to respond to a really appalling anti-vaccine campaign, which led to a reduction in the uptake of HPV vaccine from 87% to just 50%. And I want to today sincerely congratulate and thank the National Immunisation Office, so many of you in this room and so many of you watching across the country, the HSE Communications Office, all of the people who came together to push back and run a really, really successful HPV vaccination alliance. I see Anne from the IMO here. I know there's many others here who all partnered together, their organisations, to say we are fighting back. And I think particularly fondly and with sadness of the late Laura Brennan, who was so courageous in this area and really gave so much. And Laura's personal story, telling people, if this vaccine was available when I was in school, I mightn't have cervical cancer now. I mean, that's the truth. And Laura has died, but I'm determined that Laura's legacy will not, and that her work will not. And I'm so pleased that as a result of all of your work, as a result of Laura's work, as a result of policymakers, patient advocates, clinical leaders and the health service coming together, we're now reversing the trend. And we now have 70% of eligible girls in receipt of the vaccine. So we are reversing that trend. In fact, I think we've become the first country in the world, according to the World Health Organization, to actually reverse the declining trend in the HPV vaccine. But we have more to do, and we know it remains an uphill battle, because outbreaks and reductions in vaccination rates serve as painful reminders of the scale of the ongoing challenge to promote the benefits of vaccination. And principal amongst these is vaccine hesitancy. Vaccine hesitancy has, as I've said already, been identified by the WHO as a major global threat. And in Ireland, it's affecting our uptake rates, most notably for MMR and for HPV. The main challenges, I think, for policy makers in combating vaccine hesitancy, particularly in the context of social media, is tackling the twin issues of misinformation and of disinformation. I understand that there's genuine concerns among parents in relation to vaccination. Every parent wants to do best by their child. And when they're logging onto their Twitter or their Facebook or their Instagram or whatever, wherever we get our news and information these days, and they're seeing this information, it's not surprising that that causes people to ask questions, that causes people to be concerned. Vaccine scares make really good headlines. And unfortunately, they have a couple of supporters in the Oireachtas who continually put down parliamentary questions or table debates, giving more oxygen to the nonsense. And the stories of those suffering from the long-term effects of diseases such as meningitis and measles, which could be prevented by vaccination, rarely get the same degree of headlines or the same degree of prominence. So it is so vital. It is so vital that parents are given accurate and evidence-based information about the benefits of vaccination, as well as possible side effects, to enable them to make an educated and informed choice about their children's immunisation. And my advice to parents is really simple. Get your medical information from a medical professional and nobody else. And if you do that, you won't go wrong. So, let's not get it from, Anthony 00068A, who sets up a Twitter account and becomes an expert in immunisation. Let's not get our information about our kids' health from there. Talk to your GP, talk to your nurse, talk to your pharmacist, go to mychild.ie, go to the National Immunisation Office's website. That's where you get that reliable information. Yes, you hear about the side effects, but you get the rounded, evidence-based picture as to why vaccination is so important. So health professionals, you are so key to helping us overcome vaccine hesitancy. You are and remain, rightly, the most trusted source of vaccine-related information. You're in a best position to understand hesitant patients and to know how to respond to their worries and their concerns and to find ways of explaining to them the benefits of vaccination. So we need you to take up that leadership role, and I know that's why you're here today. However, often when I'm addressing audiences like this, I'm sometimes missing the people that I need to be talking to, because unfortunately we're now seeing in studies that even healthcare workers themselves, including those who provide vaccinations to patients, can be vaccine hesitant, whether for themselves or their children or their patients. Imagine a new mom going in to see a doctor and to hear from the doctor, well, actually I didn't get my third child vaccinated because I didn't think it suited them. So imagine a nurse at the bedside of her patient saying, I didn't get the flu vaccine because it gives you terrible headaches. I mean, healthcare professionals here really need to get on the pitch. You need to get on the pitch here, and you need to step up, and I need all your help in relation to this. We cannot have healthcare professionals adding to the misinformation and disinformation in this regard. And that's why what we now need to do is we need to build an alliance. We need to build an alliance that is broader than what we've done in relation to HPV, but building on its success. We need to use the likes of the Healthy Ireland Network. And I've announced my intention, and indeed had a really good meeting with Kevin and others yesterday, to establish an alliance of healthcare professionals, policymakers and patients to promote vaccination, with a particular focus on the childhood immunisation programme and the HPV vaccine for both girls and boys. This alliance will aim to ensure that accurate, evidence-based and consistent messages about vaccination are spread, are understood and are acted upon. We intend to launch it at the Global Vaccination Summit in Brussels in September, and to do the preparatory work between now and then to get as many people and organisations as possible ready to sign up to play their part. We need parents groups, we need medical colleges, we need trade unions, we need patient advocates, we need everybody to come together and to help direct people to reputable sources of information. It will seek to improve the understanding of and confidence in vaccination, not alone among the general public, but also among healthcare professionals. One intervention that has garnered a lot of attention recently is mandatory vaccination, not just in this country, but across the United States and across the European Union. This is a debate that is heavily underway. Governments are introducing various forms of mandatory vaccination. I've heard my British counterpart talk about it as recently as this month. I've seen the moves taken by the German health minister. We've seen what they've done in the state of New York as well. And a review of 31 countries in Europe now finds that 11 have some form of mandatory vaccination. In 2017, the French Parliament passed a law extending the vaccine mandates for children up to 2 years of age from 3 to 11 vaccinations as well. So each country has approached this in a different way. I want to win the argument on vaccination. I want to win by persuading people of the benefits rather than just taking the mandatory route. But I do need to look at all policy options and all levers that we possibly have, and the Attorney General and the Department of Health are looking at all of the various mechanisms that may be available. I also intend in the next month or so to put before the Dáil a cross-party motion calling on every member of the Dáil to support childhood immunisation programmes and HPV vaccine. I don't think it's too much to ask for our public representatives to come out and pledge their support for the vaccination. But there is no panacea, there's no magic wand in relation to this. It's going to require a multifaceted approach rather than relying on any one intervention. And that's how we were going to, I suppose, have a more effective response in relation to that. My department has initiated a process to develop a new policy framework in relation to infectious diseases, to be completed by early 2020 as well. We're also looking at the reviewing and the restructuring of the National Immunisation Advisory Committee as well, and we're also looking through our work with GPs through the new GP contract for cooperation in terms of an ICT solution for immunisation as well. So there is so much that we can and we will and we must do together, and I'm really excited about working with clinical leaders, with doctors, with nurses, with public health specialists right across the country. But today I really come here to appeal to you to work with me to redouble all of our efforts, because this is a fight worth taking on. This is literally a matter that we could make decisions together today, we could take actions together today that will save the lives of Irish children now and into the future, and vulnerable people now and into the future. But I also come here today on behalf of government and on behalf of patients across the country to sincerely thank all of you, to thank you for your leadership, to thank you for going above and beyond the call of duty, coming to conferences like this, becoming informed and taking on leadership roles and going back to your place of work and to your community and spreading that information. We all need to work together on this, policymakers, clinical leaders and patients, and I've no doubt if we do, as we will, we'll come back here to next year's conference and the conference after that, and we'll continue to see the positive impact of our work, just like we're seeing on the HPV vaccine this year, just like we're seeing on the rotavirus this year. So thank you so much for all that you do, and I really look forward to working with you all. Gurmila Malav.